Hi, I'm Dr. Moreno, and I have two practices in the North Tampa area, one called Evolution to Total Balance, another one called New Age Medical Center, where I practice functional medicine. I started coming to some of the main meetings about 10 years ago, and then shortly thereafter I started the fellowship program. And what I like about this fellowship in functional medicine is that it takes you back to the basics, to what you were taught in medical school. It takes you back to biochemistry, physiology, things that most doctors don't get exposed to anymore once they're out of medical school. Unfortunately, the only education that most doctors get now is these drug reps or these drug meetings, and it's all about drugs. You know, they don't teach you about physiology, and hormones and how that affects patient care. The normal way practices are set up now is more like treating the disease, not preventing the disease or what's causing the disease, It's all about therapy, but not prevention, yeah. It's been estimated that 80% of disease processes are due to lifestyle. And I think a lot of it comes down to like lack of sleep, stress. We have 24-hour days. 8 hours should be work, 8 hours should be like play, and 8 hours of sleep. But unfortunately these days that's not what happens, So we try to, find out what's going on with their lifestyle. And then obviously because of that, explain to the patient that causes problems with adrenals, like your hormones, and that's why they're having trouble sleeping. And then we also look into their diet to see where they're having an imbalance in their diet, especially if they're eating too much gluten, and we can tell on their physical exam that there's things that can clue us towards a gluten problem. And then we also then go into testing. I usually start off with the gut first. The cause of most of these issues with weight and diabetes and hypertension, it all starts with your gut, with your digestive system. If your digestive system is inflamed or has leaky gut or is not absorbing things right, it's causing toxins to get into your body that shouldn't get into your body. That starts a whole cascade of problems with your hormones and weight. So I think gut is very important. I do nutritional testing, which checks any kind of deficiencies, amino acids, vitamins, minerals, and I also check for any kind of gut imbalances, stool analysis for dysbiosis or imbalances in bacteria, good versus bad. If there's problems with candida, with yeast, there's problems with inflammation for leaky gut, or problems with the pancreas, or liver, whether it's not detoxifying or causing enough issues with the bile, and pancreas with pancreatic enzymes. So there's a lot of things we can start off with as far as the gut. When it comes to BHRT, you always want to use what your body recognizes as itself, which is the bioidenticals. Nothing synthetic, which has been patented or created by a pharmaceutical company. You want something that you can measure in the blood or in the saliva, and you can titrate the therapy and you can monitor, so we're not just hocus pocus, like a little bit of this, a little bit of that. We're actually looking at the deficiencies after we've done a good physical and good history, so they all kind of tie in together. I've also added to my practice in the last couple of years therapy called platelet-rich plasma. It's using your own growth factors to help stimulate growth, like in your face, collagen growth. If you have receding hair or hair loss on your hair follicles for hair replacement, we could put it there. We also use it in the knees, primarily for osteoarthritis. It helps stimulate new collagen growth. So these are growth factors that are released by these platelets that we're able to separate from the blood and concentrate. So very, very effective therapy for those things. So if you'd like to schedule a consultation or know more about my practice, please go to newagemedicalcenters.com or Evolution to Total Balance, two different offices.